My name is Rebecca Foose. I'm with the Friends and Foundation of the Rochester Public Library. And today we have Planned Parenthood, Myths and Facts with Rick Bartell. With all of our programs, we ask you to listen respectfully to our guest presentation. And Rick is inviting this to be kind of a dialogue with questions and answers throughout the presentation. But we just ask that you raise your hand and wait to be called on. If you can keep your question in the form of a question and kind of brief, we can get to as many as possible throughout the talk today. So the Friends and Foundation thought it was time to bring Planned Parenthood back to the library for a program. They were here 52 years ago. November 17th, 1964, Planned Parenthood Federation of America board member Margaret Hayes Baum reviewed The Time Has Come by Dr. John C. Rock, pioneer of the birth control pill, in a time when contraception was still illegal. It's interesting that the library was forward-thinking enough to review that book in 1964, and that libraries remain safe, trusted places for such conversations like today's to happen. So we thank you for your past and current support to keep these conversations going. So today, Rick Bartell, the Regional Director of Education and Outreach at Planned Parenthood of Central and Western New York. Rick has worked at Planned Parenthood for over 22 years, seeing the organization through many changes. In addition to his time at Planned Parenthood, Rick has worked in various roles in the field of education over his 40-year career. As the Regional Director of Education and Outreach at Planned Parenthood, he oversees a 5-county rape crisis service, Restore, the only rape crisis service in these counties, a teen pregnancy prevention program called In Control, a community education department, a program that teaches technical assistance to family planning clinics in 27 upstate counties on the New York State Family Planning Benefits Program, and maintains a clinic escort program for the affiliate health centers. Rick is a longtime and dedicated leader of Planned Parenthood and an expert educator. Please join me in welcoming Rick Bartell to our podium.
Thanks. Well, hello. Thanks for inviting me. I hope it's not another 100 or 57 years before we get invited back. But yeah, and Maggie, who did that review, is a wonderful woman who passed away just a few years ago, but has always been a real friend of Planned Parenthood. So again, my name is Rick Bartell. I'm the Regional Director for Education and Outreach at Planned Parenthood. What I'm hoping today to do is to present to you kind of some surprising things around Planned Parenthood. I'm hoping if you leave today and go, I never realized Planned Parenthood did that, I will have succeeded. So let me, without further ado, let me just get started and show you Planned Parenthood. And this is a kind of new for us. If you look at Planned Parenthood of Central and Western New York, we're a reasonably new affiliate and a very old affiliate. We've been around for over 80, 90 years. Began back in the 1920s, 30s, when Margaret Sanger came to Rochester, almost got arrested for talking about birth control, and started the Monroe County Birth Control League. Over the years, we have kind of grown and expanded. As of 2 years ago, we merged with our Buffalo affiliate. And so for now, we have, just in terms of the geography of Planned Parenthood, we go from Buffalo and have clinical services in our Buffalo, Niagara Falls area. Think of the thruway across to Rochester. Think of the thruway across to Syracuse. And we take care of all of those counties across the region. As a new affiliate for Central and Western New York, we always like to put up kind of our Planned Parenthood of Central and Western New York, our vision and our mission. Protect and provide health care and education that empowers individuals and families without respect, without judgment, and no matter what. The no matter what, I think, is a good thing. It's one of the things that I've always respected, and why I'm with Planned Parenthood for all these years, is the no matter what. It's one of the few agencies I can think of that has really stood for something over the years. I mean, when you think back to back in the early 60s when Planned Parenthood had the guts to, in Connecticut, had the guts to provide birth control to married couples when it was illegal. And then it became a court case and became legal for married couples to provide, to have birth control. We've always kind of done this no matter what. And I always think of my shorthand version of our mission is, I always think of the famous philosopher John Mellencamp, who said, you've got to stand for something or you're going to fall for anything. And I just felt like we've always stood for something. What I'm hoping today is to go over all of our services, talk about some of the things, hopefully surprise you a little bit. But our first, and where we're going to kind of start, is our numbers. This is the service area that we provide clinical services to and educational programming, all of our programming. We have one mobile unit which is out in Erie County at the moment, and we're working on kind of expanding that. We have 10 health centers across the region. We have a group of health centers in Erie and Niagara County, and then think forward to Genesee County. We have a beautiful little health center in Batavia, New York. You come out here to Rochester area, we have a health center in Greece, right across from Ridgemont Plaza, and we have our main office at 114 University Avenue. Go across a little bit longer, and we've got a clinical site in Canandaigua, and then all the way over to Syracuse, where we have another large clinical site in Syracuse, New York. All of those sites provide all sorts of reproductive health care visits. If you look annually, patient visits, that's 43,000 patients, 43,000 visits across that region. It's a phenomenal number. We are an integral part of healthcare across that region. Another interesting statistic, one in five women will turn to Planned Parenthood at some point in their lives. I always think it's a perk of my job when I'm out and people say, well, where do you work? And you say Planned Parenthood. Half the room doesn't talk to you the rest of the night, and then the other half comes over and says, "You saved my life in college." So it's a really interesting demographic. But a ton of women come to Planned Parenthood at some point in their lives. Our health services, and again, I'm not going to spend a ton of time on our health services. I feel like whenever I walk into a room like this, one of our services you all know about. It's what gets reported in the paper. It's kind of like right after you say Planned Parenthood, you read abortion. It's a service we're very proud of. It's a service that we provide. But it's a small service in terms of those 43,000 visits that you saw before. But we like to mention it. We like to talk about it. We have abortion services in Buffalo, New York. We have in Niagara, New York. We have abortion services here at University Avenue in Syracuse, and then we do medication abortion across all 10 of those sites. An integral part of reproductive health care. But we also do a ton of other things that often surprises people. Breast exams, colposcopy, tons of contraceptive services, emergency contraception, health counseling, HIV testing, pregnancy testing, smoking cessation. So we're really an integral part of healthcare delivery across that region. When you think of those 43,000 people that or 43,000 visits that we deal with every year. I like to point this out, but it's not where I'm going to spend most of my time. I feel like this is where these are the kinds of services that you hear about and you know about Planned Parenthood. I'd like to surprise you with, I think, a few that you may not know about. Our first is educational programming. I have an education department. We are the largest sex educators in the nation and here in Monroe County. Last year, we spoke in front of about 23,000 people across the region on all issues of human sexuality. We go into middle schools, we go into high schools, we go into colleges and talk about all issues of reproductive health. Middle schools, we're talking a lot about puberty and puberty education. We do a lot of work with PTAs and having parents and how to talk to your kids about sex. At high schools, we're doing an awful lot of, and high school age kids, we're doing an awful lot of programming on birth control, STIs, healthy relationships, all sorts of programs around that. At the college level, we do all those same kinds of programs, although at the college level, we can usually ratchet it up a notch or two. We can pass out condoms, and I don't have a teacher in high school sitting in the back of the room sweating bullets about what I'm going to say next. So usually, so we do a ton of work around all of that. Some of the places you may not know that we go to, we do a lot of educational programs within jails. And for instance, in Ontario County, we work every other week in the Ontario County Jail with young women who are about to be released, and we talk about birth control, family planning, healthy relationships. We do a program once a month at Albion Correctional Facility where we work with the inmates who are about to be released. We do all sorts of programming down here at day reporting. We're in most of the county jails. We do an awful lot of programming, educational programming at drug rehab places, Park Ridge, chemical dependency, Jacasa out in the western region. So we do a ton of programming around all of that. So our educators are out in the community talking about responsible sexuality. So it's one of those programs that I don't think gets enough play within the paper. Next is Restore. Restore Sexual Assault Services, one of the programs that I take care of that I'm probably one of the most proud of. Planned Parenthood, and hopefully this is a surprise to y'all, Planned Parenthood for the past 40 plus years has been the rape crisis service here in Monroe County and the surrounding counties. So if back in the old days when you had yellow pages, if you looked in the front of the yellow pages and you saw if you're the victim of a sexual assault and there was an 800 number, there's a hotline 24 hours a day to call, that was a Planned Parenthood number. So for over 40 years, we've been running now 2 hotlines. And if you're the victim of a sexual assault in Monroe, Genesee, Orleans, Livingston, or Wyoming counties, if you call that number 24 hours a day, 7 days a week, it's our mission to have someone standing next to you within about an hour. That can be at 4 in the morning. And what that person does, it's your victim advocate. If you're the victim of that sexual assault, they come by and talk to you about all of your options. And they are your advocate throughout that whole system. And it may be as simple, and it's really not simple, but as simple as talking to the victim and providing kind of short-term counseling and kind of putting their lives back together, to going to the police and reporting this, going to through the court system. So they will follow this person up to maybe 2 or 3 years to follow them through this whole system and advocate for them for health care, advocate for them for through the court systems. We have relationships with all the police departments, all the court systems, and spend a lot of time with these victims to advocate for them. And one of the other services that's part of Restore that we started probably 12, 13 years ago was the SANE program. SANE stands for Sexual Assault Nurse Examiner Program. We got a grant from the New York State Department of Health, and again, this is a Planned Parenthood program. We got a grant from the OVS, really, Office of Victim Services, I should say, to provide work with mid-level providers in all of the area hospitals. Before we got involved with that program and brought that to Monroe County, 80% of the evidence kits, the rape kits that were collected, were inadmissible in court. And that was just an amazing statistic. And what we have done is kind of revamp that whole system. We train all the mid-level providers for effective forensic exams in all of the area hospitals. We meet on a regular basis with the DA's office, the criminal justice system, all the ambulance corps, police departments, the crime lab. We are the people that design and provide the rape kits that are in all the area hospitals. And so we supply those to every area hospital. That's, again, a Planned Parenthood program. We've made great progress in terms of providing forensic exams and effective forensic exams so that they're no longer inadmissible in court. We are the victim advocate, and some of you may know the Bavona Child Advocacy Center. When the Bavona Child Advocacy Center started and opened its doors, Planned Parenthood was there, and we provide 2 full-time staff members that are at Bavona who do the same kind of victim advocacy that we talk about with our rape crisis service, but with children who are the victims of sexual assault and physical assault. So we have been kind of at the front door with Bavona for years, and again, one of those amazing services that people don't realize or don't associate with Planned Parenthood. Another brand new program that I'm going to be meeting this afternoon to try to figure it out. I don't know if any of you have heard the program that came out of the New York State Governor's Office, Enough is Enough. It's a program that's working to bring down the rate of sexual assault on college campuses. And so we got the second largest grant, this is Planned Parenthood again, second largest grant to provide those kinds of services, similar kinds of services that we've been providing out in the community on college campuses. We have MOUs with most of the area college campuses here in Rochester, and in the next few years you'll be hearing a lot more about us working on college campuses to provide that victim advocacy and to work with the college administration on putting together some sensible systems in place to try to prevent sexual assault on college campuses. So I always think this is one of those programs that people don't necessarily associate with Planned Parenthood. Any questions yet? Yep. What college campus was this? Huh. I'm not familiar. I mean, that's not normally what we do. I'd have to kind of look into that. Huh. At the U of R. We do, and again, it's the U of R that sets the stage for that. We're invited in for them. I'm not sure of that particular program. We tend to emphasize not throwing condoms at people. It's not the way you distribute condoms. I'm not sure we did that, but yeah, we do a lot of RA training at college campuses, and I'm not sure of that particular program. That's not necessarily how we normally deal with that. Any others? Yeah.
What's the story behind the absence of Ontario, Gates, and Plain counties from your restore program when you actually serve the same broad area?
Mm-hmm. Every county in New York State has a rape crisis service. And so there's a charter for every county. And these are the counties that we have gotten kind of that charter. There are other people, there's a rape crisis service that serves Ontario County already. So for instance, if I had come here 8 or 9 years ago, Wyoming County wouldn't have been on this list. And we were asked by Wyoming County to kind of come in and provide the rape crisis service there. Interestingly enough, and I'll get right to you, interestingly enough too, in Wyoming County, we have just been asked to be the domestic violence program there, which is new to us. And so within the last couple of months, we've just set that up.
You mentioned the programs for women coming out of confinement.
Mm-hmm.
And you speak to women about healthy relationships and so on. Why are you not dealing with the men coming out of prison? Do the same thing from a different point of view. They have a responsibility toward women, but women have a responsibility to protect themselves from men. That's kind of lopsided.
Right, and I'm glad you mentioned that. We do all of those. One of those programs is at a men's prison that I mentioned, and so. Well, it's the one within our geographic area. All of the jails that we work in down here, like for instance, we do day reporting here in Monroe County, which is juvenile. Those are all men. So, and our educational programming is about probably about 50 49 to 50% men that are in our educational program. So thanks for bringing that up. Also, and I didn't mention our healthcare services, we serve men. Those 43,000 visits include men that come to our clinical services. Anything else? I will. Man. In Control. In Control is another program. It's a teen pregnancy prevention program that we have been running for over 23 years here in Rochester. This comes from a CAP-funded program out of the Department of Health. 23 years ago, back in the early 90s, the mid-90s, teen pregnancy, unwanted teen pregnancy, the rates were some of the highest here in Rochester and some of the specific zip codes, highest in the nation, forget just New York State. And there was this huge problem that the Department of Health recognized. And what they did was they provided our grants to come up with interesting and new innovative ideas about how to provide teen pregnancy prevention. And we applied, I wrote the original grant in 1993 to provide this for In Control. Just so you know, we have a CAP program like In Control in Buffalo. And we participate also in a CAP program, which stands for Comprehensive Adolescent Pregnancy Prevention, just a funding stream, in Syracuse. But the program In Control is here in Rochester. It's just down on West Main Street. If you think of Nick Tahoe's and you think of where Susan B. Anthony House is, we're kind of right in the middle. We were picked because of the certain zip codes that exist down in that area. If you go down In Control, it's a green awning building. It's kind of a teen hangout center. And if you go there anytime after about 2 o'clock, you will see anywhere between 30, 40 to 60 kids participating in all sorts of programming. Again, we've been doing this since 93. In the zip code areas that we've been working in, the teen pregnancy rate since the 90s has come down by as much as 40%. We're going to take credit for some of that. The teen pregnancy rate in general since the 90s has been coming down, but not to that extent. And we think we've got a really interesting secret, and actually the federal government has come down and studied In Control. We were hosting 2 research groups who have looked at kind of the unique programming around In Control from Health and Human Services. And they produced 2 reports talking about innovative programming that are happening around the country. And they picked 12 programs. In Control was one of them to highlight. In Control has a number of components to it. It's really, the goal of In Control is to reduce the teen pregnancy rates within certain zip codes in downtown Rochester, reduce the STI rates, and to delay the initiation of sex as much as possible, for as long as possible. Those are the 3 simple goals for In Control. And how we get there, I think, is an interesting story. First of all, we have educational programming. I've got educators who are connected to In Control that kind of do street outreach and are out in those communities. We do evidence-based programming, 6 or 8 week kinds of programs around relationships and responsible sexuality and all sorts of things down in those neighborhoods. We also have a cadre of peer educators, probably 25 peer educators who are trained. We recruit them in the spring and work through the school year. They are trained about 45 hours worth of training on all sorts of issues. They do a lot of our educational programming around the evidence-based programming. Go out in the community, street outreach. They know the community and they know who should be recruited for In Control. But I think the most important and unique thing about In Control is it's a youth development model, and we use a youth development model to work on this teen pregnancy prevention issue. And what we do is we discovered you can't keep saying no, 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 no to kids. You have to give them something to say yes to. And so what we do down at In Control is give kids kind of a future. The kids who are coming into In Control haven't been down to the other end of Main Street in all of their lives. And so we're working with them to give them some possibilities. Because when you don't have those possibilities, I should do it the other way. If you have those possibilities, you become effective contraceptors. If you're going to college, if you have a career, if something's happening in your life to move things forward, then you become an effective contraceptor. The third part of this program is that we do give free clinical services to anybody at In Control that wants them. But let me give you just a hint of some of the programming that we do down at In Control. In Control has a college program. We take high school freshmen from the Rochester City School District, and we put them through a program that we developed for about 16 weeks. They do journaling. These are kids who haven't, probably they will be the first kids in their family to go on to college, so they don't have that residual of SATs and what am I supposed to take, and I have to take a language or I don't, how am I going to afford this? We take them through all of that, put them on the internet and talk to them about SATs and figure all that out. We then, after about 8 or 9 or 10 weeks, we take them on college tours, and we do a local tour, which is from Buffalo to Syracuse, and there's like a bajillion colleges, and we get them on college campuses, show them kids that look like them, show them kids, and get them hooked up with the financial aid people. They get to tour the colleges and just figure out. And again, these are high school freshmen. Figure out that this is a possibility, and then God help us, we go on a national tour. We take about 20 kids. We've been to Washington, D.C. and Virginia and toured the historical black colleges. We've gone down to Atlanta. We've been to New York twice now. I think we're going back to Washington and Virginia this coming year. We haven't lost one kid yet, but I can't guarantee. And it's... So we get them on there. Then they come back as high school freshmen, and they start to go through their high school years. We provide tutoring for them. And we've had a surprising number over the years go on to college. The one story, there's a kid that we picked up when he was 16 years old. He came down to In Control. He still comes back to In Control when we call him to come back and talk to the kids. He went to Georgetown Law School. He was a congressional aide for a number of years, and he now is the president of his own lobbying firm in D.C. Comes back to In Control. We have a music program down at In Control. So we do, we take kids, again, about an 8-9 week program that they sign up for. And of course, every kid that comes down to In Control's music program is the next rap star. So, just so you know that. And we put them through this music program. The first 5 or 6 weeks of the program, we don't get near music. We're talking, we bring lawyers in to talk about copyright law. We talk about all the other careers that are in the entertainment or music business. We talk about the actual techniques of recording. We get them on computers and figure out how to run those boards, and figure out all the other, the careers that are involved with the music industry. But then we have a membership or a collaboration with a local, very famous music studio, professional music studio, and we bring them in, and they actually do record and do work on all of those skills. If you go to the website, it's called myincontrol.com, all smushed together. When you enter the website, you will start to hear some music. Those are the kids' music that they've been producing. The 3 kids that we started this program, again, 17, 18 years ago. The 3 kids that we started the program, 2 kids were homeless. These 2 kids, well, the 3 of them together graduated from this music program. They have their own business right now that records music for a lot of the nonprofits and a lot of the commercials that happen here in Rochester. They've done 2 episodes of MTV's Cribs, and they've sold music to Sony. They come back and help out with the kids that are kind of moving forward with the In Control music program. So again, these are all youth development things that you don't really think about or associate with teen pregnancy prevention, but that's really primary prevention. If we can give those kids that future, we have the largest marching urban band in New York State. They're called the Mighty Liberators. Mighty Liberators used to be around in the 60s, and right after the riots, they kind of died out. The parents wanted to bring the Mighty Liberators back, and so the Mighty Liberators now go around all of upstate New York competing as a marching band. Started out, we had 5 kids in a room about this size, and we'd march back and forth. Pretty soon we were out in the parking lot, and soon after that we had a full marching band. We do, because Rochester is a big film industry, we do, every summer, we take 30 kids and we bring them together. It's the first time they've been together and have no film experience, hook them up with a local film director who works with them to produce a movie. We tell them in June, we're going to write, direct, you're going to shoot it, you're going to score it, you're going to do everything, to produce this movie. And in the fall, early August, we're going to have a premiere at the Little Theater. And they really can't believe that. And so what we do is they do that. We've done now about 10 or 11 films, 15-minute short subjects, which we use for educational purposes now. But the kids wrote them, directed them, scored them, and they're phenomenal. About 5 years ago, one of the films that we made was called Unwanted. We entered it. The kids wanted to enter it into the 365 Film Festival for teens. That's part of the whole film festival here in Rochester. And out of 150 national entries, they won. And they've never touched a film. This is the first film they've ever done. So it was pretty phenomenal. We also do that with plays. Every summer, we take 30 kids and produce a play that's done at School of the Arts. Last year, we were over with about 500 kids. So again, there's a ton of work that goes on around this youth development model that actually is primary pregnancy prevention. Any questions about In Control? Yeah, sorry. I can go back. Yes?
Do you have any focusing in Spanish language? Because the Mexicanos in this area are the largest minority group.
Mm-hmm.
And they're really paying attention to the Latino communities, which are often ignored.
Exactly. For In Control, the state requires us to be in certain zip codes. That's not the zip codes that you're talking about. The zip codes that have a high Latino population has been in another area. There's 2 other CAP grants that are here in Rochester that are producing programming, and they are focusing more in that neighborhood. So we don't, but it's not forgotten. Anything else? One of the other programs you may or may not know about that Planned Parenthood does, it's this Family Planning Benefits Program. We call it FIP-BIP. And it's something that's kind of underutilized and people don't realize it. It's a insurance vehicle for New York State. It's run by the New York State Department of Health, and anyone who's a New York State resident and makes a certain income, and it's pretty high. So a single person, single woman, male, that could make almost up to $30,000 a year and still qualify for the Family Planning Benefits Program. And what that does is it provides free reproductive health care for males or females across New York State. So they can get their annual checkups, their birth control methods, everything is free. And it's one of those best kept secrets in New York State. What we are doing is trying to work on not making it one of the best kept secrets. New York State has funded 4 people to promote the Family Planning Benefits Program in New York State and work with family planning clinics to provide them with technical assistance on how to run this, because it's sometimes difficult for family planning clinics, especially small family planning clinics, to get paid. And so there's 4 people, and there's 4 people. We house one of them, and that's one of the programs that we take care of. So here in Monroe County, I have a coordinator. There's one that takes care of the Adirondacks. There's one that takes care of downstate, and there's one that just takes care of New York City, which is a whole thing of itself. So my person, Judy Sauer, takes care of the Family Planning Benefits Program in 27 upstate counties. So she's all over upstate New York, from Buffalo, and you think of all the way down to the southern tier, the Finger Lakes. And what she does is she goes around and promotes with all of the family planning clinics that exist, whether they're Planned Parenthood clinics or not Planned Parenthood clinics. All the family planning clinics exist, how to help them develop the Family Planning Benefits Program. She also goes out and does a lot of presentations at WIC centers and everyone who could probably utilize the Family Planning Benefits Program better than they do. And she provides that technical assistance so that when a family planning clinic down in Cattaraugus County or something is having trouble with the state and getting reimbursed for this program, she kind of runs interference. So it's another one of those programs that you probably didn't think of with Planned Parenthood. That's kind of we're all over the place, and we're more than our clinical services, although we like those clinical services too. Any questions? The Family Planning Benefits Program? At least 10 years. I want to say 10 to 15 years.
It wasn't around when my girls gave birth.
No, it was something new. I don't know if you remember when a lot of welfare reform came through, and then there was this thing called a waiver for Medicaid, and all of a sudden people could get states could take advantage of this waiver, which is what produced. There's a number of programs all over the country. They're not called FIPIP. That just happens to be New York State's waiver program. So it kind of came about, and it really revolutionized things. But our big thing is that the government hasn't been promoting it enough. People don't know that most of college kids could get free birth control. Did you have? Go on.
What kind of contact do you have with the Catholic Family Center?
Interesting contacts. We absolutely have contacts with most of the Catholic family centers. We've shared space with Catholic family centers in other places, not here in Rochester. We have a relationship with them. Not always, we would love to have a closer relationship with them. They do wonderful work. Often it's kind of below, they'll call us and say, what can you do with us? We just can't acknowledge it. So, and we're in contact and work with Catholic families in Syracuse, and we're working with a CAP program there that we're one of the partners that we kind of collaborate with. So we would love to have closer relationships, but it's mostly they have a problem with.
Sort of sub-rosa.
Yeah. So yes. Mm-hmm. Yeah, although that's not so utilized as much anymore, but yes. I mean, all the hormonal. Well, all of those implanted methods, Norplant, and that's kind of the older one, the IUD and all of those, we love them. That's part of why the teen pregnancy rate has come down so much. We call them LARCs, long-acting reversible contraceptives. And LARCs are really revolutionizing family planning. So, for instance, the IUD, we do an awful lot of work educating people that the IUD today is not your mom's IUD. So it's a really effective. We can insert that into women who want it, and it's an amazing. For 5 years we'll see you. So it's those are really revolutionizing family planning. Norplant was one of the early ones, and it's not really as utilized as some of these others now.
But they do educate.
Yes.
As to the IUD.
Absolutely. Absolutely. In fact, we emphasize LARCs as methods, especially for teenagers who are interested in getting on a contraceptive.
Would you say that has been successful?
Yes.
I mean, increasingly, can you explain why it's been more successful? I mean,
It's-
why have you been able to convince more people maybe to take it on?
Well, I think we've been educating more on it. The medical profession has changed. So when I first came to Planned Parenthood, you couldn't get an IUD if you had multiple sexual partners. You weren't in a monogamous relationship. You had to have already had a child before you could get an IUD. There was this list of rules, and those are all gone. The medical profession has changed in all of that. So there's that piece of it. The other side of it is it's so much easier for women to get a LARC method, and then they don't have to think about it. Our call center used to get lit up on Monday morning with questions about, I forgot my birth control pill. Can I take it now? My dog ate my birth control pills. What do I do? then it's not. It's something you didn't have to hide from everybody and put it. So it's really revolutionized the way young women we provide contraceptives. They don't have to think about it. And so if you have an IUD, it's 5 years, or you have and maybe a patch once a month, as opposed to trying to remember to take your pill at 8 o'clock that morning.
Don't hear it mentioned as often as common sense.
True. I mean, I think we've got to do a better job of talking about LARCs. And I could be wrong, but I believe we are, at Planned Parenthood, one of the leaders in terms of inserting or using LARC methods for young people. We do more of them than most. One of the downside, or the tough parts, is for a lot of OBGYNs and everything, it's a very expensive method up front. So an IUD may be, and don't quote me, it's $300-400 at a shot, as opposed to your pills are.
Do they supplement LARCs? I mean, are there programs that you can supplement for somebody that can't afford it?
Yes, and that's the Family Planning Benefits Program. We are also a Title X clinic, so we always have, and that's provided for women who have low means. And a Title X clinic always has sliding fee scales. So anyone that comes into our building and is coming for an appointment, their fee may slide down to zero depending on their income. So there's all of that. But LARCs have been an incredible method for. That's one of the reasons. In Control will take some of the credit. Another reason the teen pregnancy rate has fallen by that much is because of the LARC methods.
Why is it that advocates who are opposed to abortion so much more successful? That one issue than Planned Parenthood is with all the other programs that you offer. I'm 75 years old. Of course, I'm not a frequent, but I have granddaughter.
Right.
I have a daughter, and I had no idea that you guys offered all those services. Yet, the opponents of abortion, we just had an example. They did for months present a bidding bill that was totally false.
Right.
And no one from Planned Parenthood that I went through the defense of Planned Parenthood, but these people did it all over the country and were very successful until only recently when they went to court.
Right. Well, that's part of why I'm here too, and why I didn't want to spend a ton of time on abortion, because I feel like that's the thing. Right. And unfortunately, whenever the paper, the DNC or the New York Times or anybody calls us up, that's what they want to talk about. They want to talk about abortion, because that's the thing that they need to. We need, and you're exactly right. That's why I'm here. We tried to push an awful lot of. There's so many other things that are happening at Planned Parenthood. We need to get that message out. Unfortunately, a lot of times the bigger media. In Control is not as sexy as abortion in terms of, getting the word out around that. So I agree with you, and we have to do a better job of promoting. And the difficulty is that we're not ashamed of. So we're always sticking up for our abortion services, and it's not something we want to downplay. We're proud of those services and see them as an integral part of reproductive health care and health care in general. So it's a difficult line to walk if someone's just throwing stones and we're going, yeah, but. But I agree. We often talk about people don't know about all the other things. So I was glad to hear. Exactly right. That's why I tried to spend more time on a lot of the issues that you don't hear about with Planned Parenthood. Any other questions? Yeah.
Has Planned Parenthood been obliged to resort to a lobbyist in Washington?
I'm not sure what you mean by. Are you an advocate for lobbying, or we do have lobbyists? Yes, we have.
Have been obliged to fight the opposition to Planned
Absolutely, we are.
by lobbyists?
Absolutely, we have a whole political arm of Planned Parenthood. Planned Parenthood we are a 401c3, a nonprofit that talks about this. We also have a whole another side of Planned Parenthood that's a 501c4, which is more the political arm of Planned Parenthood. It's really key, and we have a whole political affairs contingent and programming that I really didn't spend a whole lot of time on. Even here at our local, it's important that we are aware and we educate our state representatives and our national representatives about these issues. What are the best practices around teen pregnancy prevention? What are all the, so we actively work with them. There's a group in New York State called Family Planning Advocates that is basically a lobbying firm or an advocacy group for family planning, not just Planned Parenthoods, but family planning all across New York State. So, and it's important if we don't just educate, but then don't provide the health care services. So if we educate people about how they can get on birth control or prevent an unwanted pregnancy, but don't provide them the means of getting that unwanted pregnancy, the education is useless. The other side of it is if the government can renege on the government could take away those rights tomorrow. And so those three legs of the stool need to be fully enforced. So yeah, we have a huge effort around that. Thanks. I'll be around. I'll chat with you in a minute. I'll be around and hang around if you've got other questions, but thank you.